Hi everyone, my name is Russ Chapman and I'll be presenting you a series of short lectures on the joints and kinematics of the vertebral column. When you first stand back and look at the vertebral column, you'll see that it's literally a series of individual vertebrae connected to each other through joints. As with all anatomical structures in the body, there's some structural requirements for the vertebral column and there's some mobility and dynamic requirements. And as we move through the regions of the vertebral column and look at some individual vertebrae, you'll see that there's been trade-offs between those structural and dynamic or mobility requirements. The first structural requirement of the vertebral column is to be able to accept the weight of the body and be able to transfer this through the vertebral column itself, down through the pelvis and hips to the lower limb and down to the ground. The vertebral column needs to be shaped or positioned in a way that this is done so efficiently from an energy point of view, but also that it places the least amount of stress or strain on the structures within the vertebral column and the structures that attach to the vertebral column. You can see this in the picture on the left, with a line representing the center of gravity falling through these structures down to the ground. But obviously, the trunk is not going to stay in the anatomical position throughout our daily activities. And we have two upper limbs coming off the trunk and two lower limbs coming off the trunk. And they're going to be going through dynamic movements throughout the day. So the second thing that the vertebral column needs to do from a structural point of view is act as a rigid base of support for those two upper limbs and two lower limbs so that they can produce movement. The third structural requirement of the vertebral column is to act as attachment for the ribs. So if you look at the picture on the right, identify the thoracic vertebra, you can see the ribs projecting anteriorly from them to form the thoracic or rib cage. The first structural requirement of the ribs is to act simply as a physical barrier or rib cage to protect the thoracic contents. The second structural requirement for the ribs is to act as a relatively stable base for the origin and attachment of some muscles. One group of muscles is the axio-appendicular muscles of the upper limb or shoulder girdle. You'll deal with these in great detail in second semester. The second group of muscles runs downwards, anteriorly and laterally to form the anterior and lateral abdominal wall. We'll deal with the movements that those muscles produce on the vertebral column today, and you'll deal with those muscles in more detail next week when you look at the abdominal wall in detail. And lastly, for the ribs, they're involved in the mechanics of breathing. So from a mobility point of view, they need to be able to produce those movements. Again, you're going to deal with breathing, the mechanics of breathing in detail in second semester. The final thing to say about the vertebral column from a structural point of view is that it provides some great structural protection for our spinal cord and our spinal nerves. And this will become evident as we look at the individual parts of the vertebra. Now, from a mobility point of view, the vertebral column has two primary requirements. The first is that we're going to be moving around dynamically during the day. So our limbs are going to be moving, our vertebral column itself is going to be moving while we're running, jumping, swimming, walking, and the vertebral column has to be able to respond to that dynamically. If you look at the picture on the left again, this is the line of gravity in a static anatomical position, but as we begin to move our limbs and the trunk itself, that center of gravity is going to shift significantly. And the vertebral column is going to have to change shape to be able to adapt to that and still do all of those structural things that we've discussed. And secondly, from a mobility point of view, the vertebral column itself actually moves. And so the primary movements for the vertebral column are flexion, extension, lateral flexion, and rotation. And we're going to go through those in detail. Let's begin to break down the structure of the column itself. So if you look at the picture on the right, you can see there's 33 individual vertebrae that make up the column. This is typically comprised of 7 cervical, 12 thoracic, 5 lumbar, 5 sacral that are fused, and 4 cochlegeal. You will see variations in the number of vertebrae. It's very rare to have less than the typical number of vertebrae. It's more common to have an additional sacral, lumbar, or sometimes thoracic vertebra. It's quite rare to have an additional cervical vertebra. The two most common variations you'll see is a sacralized lumbar vertebra, where the L5 is fused to the sacrum, or a lumbarized sacral vertebra, where the S1 has failed to fuse and acts as an additional lumbar vertebra. If you look at the different vertebral regions, you'll notice they curve in different ways. The thoracic and sacral regions curve anteriorly. This is described as being concave or kyphotic. They're primary curves because this is the natural curvature of the spine in utero and at the point that you're born, and at that point, the whole vertebral column is in a primary curve. The cervical and lumbar regions curve posteriorly, and this is described as being convex or lordotic. These are secondary curves, meaning they develop in response to postural changes. The cervical lordotic curve tends to develop as babies begin to lift their head with the postural muscles of the neck and to look around. The lumbar curve develops at the time that toddlers begin to move to a bipedal posture. So the hip flexors tilt the pelvis anteriorly and the lumbar curve into lordosis as we begin to move onto 2 feet. The curves in the vertebral column are maintained by the fall of the line of the centre of gravity, as I've previously described, and we need to use muscles and ligaments on either side of the vertebral column, sometimes under tension, other times under compression, to be able to maintain these curves during dynamic vertebral movements. This is a thoracic vertebra, but we'll use it to look at the generalised parts you'll see on a vertebra from any region up and down the vertebral column. If you first look at the top picture, this is a lateral view. You can see the body of the vertebra, and its job is to transmit force from the vertebra above it to the vertebra below it. You can also see the superior articulating process, and below it, the inferior articulating process. And the job of these is to connect this vertebra to the vertebra above it, that is the superior process, and via the inferior process to the vertebra below it. The inferior process creates an inferior vertebral notch, which I'm highlighting now. The superior process also creates a superior vertebral notch, but it's not labelled on this diagram. You can see that each vertebra has a spinous process projecting posteriorly and a transverse process projecting laterally. These are used as physical levers for muscles to attach to and then move the vertebral column. Now looking at the bottom picture, we're viewing the vertebra from above or superiorly. You can still see the body of the vertebra highlighted here. You can now get a better view of the transverse processes projecting laterally and the spinous process projecting posteriorly. The pedicle is the part of the vertebral arch that connects the body of the vertebra to the transverse process. The laminae is the part of the vertebral arch that connects the transverse process to the spinous process. The pedicle and lamina are sometimes called the vertebral arch. Lastly, I've got a big red arrow pointing to the vertebral foramen. The vertebral foramen, when paired with the vertebra above and below it, forms the vertebral canal, and this is the foramen or canal that the spinal cord descends down the vertebral column in. As described at the beginning of this lecture, the vertebral column is made up of a series of individual vertebrae connected to each other. So let's have a look at how an individual vertebra articulates with the vertebra above it and the vertebra below it. Firstly, you can see the superior articulating process and the facet that we've described on the previous slide. And for this vertebra, the T6, you can see the inferior articulating process and facet. You can now see clearly how the superior articulating process of T7 in this case and the inferior articulating process of T6 join together. This is called an apophyseal joint. Apophyseal literally means a projection because the superior articulating and inferior articulating processes project out from the vertebra to form that joint. These joints are also commonly referred to as zygo-apophyseal joints. Zygo meaning there is a pair of them. So sometimes called apophyseal, sometimes called zygo-apophyseal joints, and sometimes that's shortened to Z joints. So you'll quite often hear people referring to the Z joints of their vertebral column. Both of these diagrams show the third joint between a pair of vertebrae, the joint between the two vertebral bodies, joined by the intervertebral disc. And there you can see it on the bottom diagram. This joint transmits 60 to 80% of the vertical force through the vertebral column, depending on which region you're looking at. These diagrams also clearly show how the superior vertebral notch and the inferior vertebral notch, which I'm now highlighting on the top diagram, form the intervertebral foramen. I've circled this in green on the bottom diagram. The intervertebral foramen is the foramen that the spinal nerve that's emerging from the spinal cord comes out through. If you look at the intervertebral foramen in the bottom diagram, you can see that the emerging spinal nerve is well protected by a variety of structures, including the pedicle of the vertebra, the intervertebral disc, the posterior and longitudinal ligament, the body of the vertebra, the laminae, ligamentum flavum, and the Z joints. Now that we've looked at the parts of a generalized vertebra, let's look at how those parts vary as we move across the regions from cervical to thoracic to lumbar, and also what additional features some of these vertebrae have. If you first look at the vertebral body, you can see that as we go from cervical at the top of the vertebral column to lumbar at the bottom, the absolute and relative size of the vertebral body is getting bigger, across looking superiorly and also in depth if we look laterally. This is firstly because as we move down the vertebral column, the total load or force through those vertebrae increases. Secondly, it creates more mass at the anterior part of the vertebra, thereby moving the center of gravity more over the vertebral body and taking some of the load off the Z joints, which is important as you get down to the lumbar vertebra, as you don't want too much load going through those Z joints. Looking at the vertebral foramen or canal, you can see the cervical vertebrae have, relatively speaking, the largest vertebral canal, followed by the lumbar vertebra and then the thoracic vertebra. Remember that the spinal cord is passing down this canal, and at the cervical level, you have a bulge in the spinal cord to form the brachial plexus. Similarly, you have a bulge in the lumbar spinal cord to form the lumbosacral plexus. Looking at the spinous process laterally, you can see the cervical spinous process projects relatively horizontal. You can see the thoracic spinous process is long and slender and sloping downwards at about a 45-degree angle, and the lumbar spinous process is thick and chunky and is also projecting horizontally. And lastly, the way that the Z joints articulate with each other in the differing regions puts them at a different orientation. And this has important implications for the way that these Z joints guide movements. We'll go into this in detail when we get to kinematics. Let's look at the vertebral regions in a bit more detail. Firstly, the cervical vertebra. Generally speaking, they're the most mobile vertebra. And this is important for the high ranges of movement required of the head to be able to see and to hear properly. If you look at the left picture, you can see cervical vertebrae are generally wider laterally than they are deep anterior to posterior. This is to create significant lateral stability for the weight of the head that's resting on C1 and then transmitting all the way down to C7 through the cervical spine. If you look at the top left vertebra in this picture, the atlas or C1, you can see that on the transverse process, it has a particular feature called the transverse foramen. In most cervical vertebra, this is for passage of the vertebral artery and vein. If you look at the bottom left vertebra, the C6, you can also see that the transverse processes of some cervical vertebra have an anterior and posterior tubercle for muscle attachment. If you look at the top right vertebra, the axis or C2, and look at its spinous process, you'll see that it has a bifid or bifurcate spinous process, also for muscle attachment. Looking at the right picture, you can see the superior surface of cervical vertebral bodies can be quite U-shaped, and I've indicated that with that green crescent shape. This is created by the uncinate process that I've labelled on the left-hand side, and there's also an uncinate process on the right-hand side. This adds to stability between cervical vertebrae to stop them translocating or sliding anteriorly or laterally against each other. They're highly mobile, but they have less vertical load running through the cervical region, which means that they're more likely to slide against each other, and this helps to prevent that. The final important feature of cervical vertebra is the orientation of their zygoapophyseal joints. So if you look at the bottom right diagram, you can see that the zygoapophyseal joints are orientated at a 45-degree angle between frontal and horizontal planes. We'll discuss this further when we get to kinematics. I've mentioned them, but I want to take a close look at the atlas C1 and the axis C2 because they're very important functionally and they have some distinct anatomical features that other cervical vertebrae don't have. For comparison purposes, the top left picture is of a C4, a typical cervical vertebra. Looking at the top right picture of the atlas, the first thing you'll notice is that it has no vertebral body. During development, the body of the atlas has actually become fused to the axis and is the feature called the dens. This creates a unique rotational joint between the atlas and the axis that we'll have a close look at in a few minutes. What you can see on the atlas, highlighted by that green crescent shape, is a rounded facet for the dens to sit in. The atlas is the widest of the cervical vertebra, and you'll notice that the superior articulating facets are concave in shape. This goes to my point before that the head is a significant weight for the atlas to receive and then transmit vertically to the other cervical vertebra. And this just creates a wider base of support for the head. Now looking at the bottom two pictures of the axis, you get an excellent superior and anterior view of the dens, sometimes called the odontoid process. And you can start to think about how that articulates with the atlas on that facet described before. Moving to the thoracic region, the dominant feature of thoracic vertebra is their joints with ribs. Ribs attach to thoracic vertebra in two ways, an articulation with the transverse process, called the costotransverse joint, and an articulation with the vertebral body, called the costovertebral joint. The costovertebral joint is such that through most of the thoracic region, a rib will articulate with a vertebra above and a vertebra below, so that you get demi or half facets between vertebra. I'm now highlighting these on the top left picture. The ligaments for these costovertebral joints will often blend with the intervertebral disc between the two vertebrae that it's attaching to. There are some clear exceptions that help to identify individual vertebrae in the thoracic region. The T1 vertebra has a full costal facet on the body for the first rib and has a demi facet on the bottom of the vertebral body for half of the second rib. The T11 and T12 vertebra have no facets on their transverse processes because there is no costotransverse joint for the 11th or the 12th rib. The 11th and 12th rib are commonly called floating ribs. They have increased mobility because of this lack of a costotransverse joint. There are some clear exceptions that help to identify individual vertebrae in the thoracic region. The T1 vertebra has a full costal facet on the body for the first rib and has a demi facet on the bottom of the vertebral body for half of the second rib. The T11 and T12 vertebra have no facets on their transverse processes because there is no costotransverse joint for the 11th or the 12th rib. The 11th and 12th rib are commonly called floating ribs. They have increased mobility because of this lack of a costotransverse joint. And finally, looking at the top left diagram again, I've indicated with a red line that the Z facet joints are near vertical when looking laterally at a thoracic vertebra, and looking at the bottom left diagram, again with a red line indicating it, those facet joints are at a frontal or tangential plane to the rest of the vertebra. Now on to lumbar vertebra. As mentioned previously, the absolute and relative size of the vertebral body in lumbar vertebra is significantly bigger than other regions due to the load that gravity places on this vertebra by the time you get to this level. Looking at the two pictures on the right, you'll notice that the spinous process and the transverse processes of the lumbar vertebra are relatively big and significant features. During dynamic functional movements of the whole body, when the center of gravity is shifting through the lumbar vertebra significantly, you need big, strong muscles and ligaments attached to the spinous and transverse processes to provide stability in the region or to move the region, depending on what you're doing. On the top right picture, I've pointed out two specific features that relate to that stability. The mammillary process is for a muscle called multifidus, which we'll deal with in the next set of lectures. and the accessory process is for a ligament called the intratransverse ligament. Both this muscle and this ligament provide significant stability in the region and provide proprioceptive feedback and movement in the region. And lastly, facet joint orientation. On the left picture, from a posterior view, you can see that the lumbar facet joints are near vertical to vertical. From a superior view, in the bottom right picture, you can see that those facets are orientated what they describe as radially. That is, if you draw a radius out from the vertebral body, that is the plane that they fall along. The sacrum is typically made up of 5 vertebrae that fuse somewhere around people's late teens. This essentially creates a rigid column of bone at the bottom of the vertebral column. And the reason for this is that the sacrum needs to transmit all of the vertical force through the other regions of the vertical column horizontally across the sacroiliac joint into the pelvis. Because the sacrum is made up of those 5 fused vertebrae, there are some features of the sacrum that have different names, but are essentially anatomical equivalents of vertebral features we've already looked at. It has a median sacral crest, which is the equivalent to fused spinous processes. It has a lateral sacral crest on the left and right hand side, which is the equivalent to fused transverse processes. It has a sacral canal, which I'm pointing out on the top right, and then down on the bottom left picture, which is the equivalent of the vertebral canal for the transmission of the spinal cord, or the chordae equina more specifically as you get to that level. It has superior articulating facets and processes which project upwards and articulate with the L5 lumbar vertebra. On the left-hand picture you can see anterior sacral foramina, and on the right-hand picture you can see posterior sacral foramina, and these are the equivalent of the intervertebral foramen in other vertebra that transmit the spinal nerves. And anterior and posterior rami of sacral nerves emerge from the anterior and posterior foramina. In order for the sacrum to transmit the forces vertically moving through the vertebral column across to the hip bone, these forces need to go across the sacroiliac joint. For this reason, it's an incredibly stable joint, variably moving somewhere between 1 and 5 millimeters in different planes, and most people recognize that it starts off as a synovial joint early in life and becomes more fibrotic and even more immovable as we get older. It's been suggested that the small amount of movement allowed at this joint is important when you think about the high loads coming down the vertebral column during functional movements such as jumping and running, and a bit of shock absorption and pliability that's required as we transfer those forces laterally into the hip bone. The ligaments crossing this joint to give it stability are the sacrospinous, sacrotuberous, and dorsal sacroiliac ligaments. You've studied these ligaments in detail early in the semester, and early in the semester we looked at their role in nutation and counter-nutation. If you look at the bottom right-hand picture, I've indicated with a red line there that the sacroiliac joint is also a wedge-shaped joint, and this helps to add to the stability of the joint. Finally, it's important to talk about the junction between the L5 vertebra and the sacrum itself. Looking at the middle picture of the top 3, and I'm indicating this now, you can see that the superior surface of the sacral body is sloped anteriorly about 40 degrees. Firstly, this anterior sacral tilt, and also that anterior pelvic tilt as a whole, is one of the things that gives lumbar vertebra their natural lordosis. What this means for the L5-S1 junction is that the L5 vertebra has a tendency to always slip anteriorly off the S1 vertebra. So there's a few anatomical features that help to provide stability between that junction between L5 and S1 and stop L5 from translocating anteriorly off of S1. So there's 4 major structures to prevent this from happening. Firstly, if you look at the top right picture, you can see I've indicated with the red line that lumbar facet joints are normally largely vertical. So they're orientated radially, as discussed previously. If you come down to where I've circled in green there at the L5-S1 junction, you can see that as you get down towards L5-S1, the facet joints move to a more frontal position, so that there's more stability anterior-posteriorly at that joint. The second feature is indicated on the bottom left picture, the iliolumbar ligament, a ligament that you guys have come across before. And it's running from the transverse process of the L5 vertebra down to the iliac crest. The third one is a feature I'll show you in a minute called the anterior longitudinal ligament. It's a ligament that runs down the front of the anterior bodies and then down through the anterior surface of the sacrum itself, and it helps to reinforce the anterior part of that joint. And lastly, the psoas muscle, blending with the iliacus muscle and then running over the front of the hip, helps to support that L5-S1 junction as well.